Ngathi mina ngeke ngikwazi ukuvala. Bathi sithi siyakuvala, asikuceli. Simasiqeda ukhipha umntwana siyakuvala.
Because of my status, yabo. Angisenayo i-right ukuthi ngizale futhi.
Ufana nomuntu ofile, kodwa ebephila, kodwa nje ube into efile.
These are such gross and such inhumane and so degrading, and we should not be allowing this, whether it's in law, in policy, or in practice, to continue.
Igama lami mina nguzishilo wawadludla. Ngineminyaka ewu-50 kulo nyaka. Nginabatwana abathathu bamantombazane. Kuleso sikhathi bekusenzima, bekungafani nesikhathi samanje. Bekusabukeka ukuthi nje wena usufana nokuthi usuyisilwane. Ngesikhathi sebazi ukuthi nginesifo, bazwelana nami, bangimukela isimini engikusona. Basho khona ukuthi ngingayitsheli ukuthi kuphelile, akukapheli. Ngafika ekuseni ngabo 8. Wasethi-ke namhlanje ngo-2 uzohamba uyohlinzwa. Mase usuhlinziwe siyakuvala. Ngathi angithandi ukuthi ngivalwe ngoba impilo yami isaqhubeka. Ongenzeka ningivala inzalo, mhlawumbe lo muntu engimzalele izingane ngingashadi naye. Injabulo yomuntu osifazane eshadile ukuthi ethola umntwana nalosuke ehlekisana naye. Ngathi mina ngeke ngikwazi ukuvala. Bathi sithi siyakuvala, asikuceli. Simasiqeda ukhipha umntwana siyakuvala. Ngathi ngifuna ukufonela ekhaya. Bathi-ke sikutshela lokho-ke ukuthi siyakuvala. Ngathi mina ngizokuvala. Kuthiwa hey webana uze la biza amanye amanesi. Awuzothi uthini lona? Lona akacabanga. Ingqondo yakhe incane akayicabangeli futhi akayithandi. Ungavuma ukuthi yena masithi sinika usizo, sithi vala inzalo, wena uthi awuthandi. Ngagcina sengithuleke lapho. Ya ngesikhathi sengiphaphamile emjoveni, udokotela wasesebeka la mathuluzi akhe. Wathi yena sicabangela wena. Ngathi angiboni ukuthi niyangicabangela ngoba mina ngivumanga. Ngicabangela kanjani ngavumile mina? Emva kwalapho-ke ngangikhala nje. Ngaze ngaphuma khona etheatre lokhu ngikhala nje. Akubuhlungu. Impilo yami ngiyibona ukuthi ayikho right. Nobuhlungu engangibuzwa. Ngangifana nomuntu olele phezu kwegazi kodwa lingekho.
In our top story this hour, the Commission for Gender Equality says that
the state enforced sterilisation of HIV-positive women. It found that pregnant women were being coerced into signing consent forms
at public health facilities in KwaZulu-Natal and Gauteng.
The standard procedure in any antenatal care, and we're talking about specifically people who are pregnant, is that in those months leading up to the birthing process itself, there should have been some discussion around contraception. What happened with many women is that they've alleged that when they were in the hospital, Because they were HIV positive, all of them are black, most of them are from a rural area. They were forced or coerced into signing a consent form to agree to a sterilization, but also in terms of intervention. A sterilization is not an emergency intervention. And that is a problem in this case, is that many of the women, the first time that they heard about sterilization was in that birthing process, in that emergency, when they themselves, as a patient, were in much pain, but they were also then having the anxiety and worrying about the unborn fetus.
Athi udokotela okay abuke ilontuzana ifile yami, then mayisethi ngeke ngize ngiyitetele ngoba i-status sami sithi ngipositive and futhi uzongivala, akangiceli ngizosayina, uzongivala nje ngeke ngisayithola lenye ingane ngoba ngizokwandisa isibalo sabantu aba-HIV positive. Then I cried, ngimncenga ukuthi angangivali because ngangisasemncane yabo. Ngithi angangivali inzalo, wathina uzongivala because of my status yabo. Angisenayo i-right ukuthi ngizale futhi. Hayi ke then ke nama yayingekho ke engizoyenza ngoba udokotela phela.
We live in a society where HIV is a chronic, manageable disease, and many people have gone on to have multiple pregnancies and births where their children remain HIV negative and they themselves remain healthy. Forced or coerced sterilization of women has been characterized as discrimination and violence against women.
Kodwa manje ngathi mase ngifika ekhaya ngivele ngizwe ngishaya uvalo, ngifike lezi nyembezi, ngingafuni ukubakhombisa ukuthi nginankingana. Ngingagcina ngimphendula ngamtshela ukuthi ayikho into eyinkinga ngoba nawe usungibulala kwesibili ke manje sengibulawa wena. Into okumele uyenze ngicela ungiyeke mina. Uqhubeke nomuntu ozokwazi ukuthi uzoqhubekana nempilo, okazi ukutholela ingane ngoba mina vele indaba yami ayikho. Ukuvala kwami inzalo kube isihluku esikhulu. Kumanje ngiyazi ukuthi impilo yami ayisayiphambili ngoba ngisho ukushada ngabe ngishadile, kodwa akwenzeki lutho. Ufana nomuntu ofile kodwa ebephila, kodwa nje ube into efile. Mina ngiyinto nje efile kodwa ngibe ngiphila ngoba ngiyazazi ukuthi ngiyinto nje engenamsebenzi walutho.
Sengiyaphilela ingane yami. Umkhonyana omusha lo enginaye akazi lutho nje ngempilo yami. Akazi ukuthi ngavala inzalo no. Akekho umuntu ongavuma ukuthi athandane nomuntu mhlawumbe osesimeni esifana nesami, you understand? Yeah.
Kuyangisiza kakhulu ukuthi ngihlangane nabanye besifazane abanesimo esifana nesami. Kuyangilapha ngoba noma singaqala sikhale kodwa sigcina sesihleka ngoba siyinto eyodwa.
The South African health system, as well as the government broadly, is failing the women. The department itself is yet to accept and acknowledge publicly that these gross violations happened under their watch.
Esibhedlela akaze leze bengithinta esibhedlela. Akukho nje bake baxoxa ngokuthi baxolisa kimi imistake abayenzayo.
ukuthi bengangiphenduli ithuleke akungiphathi kahle lokho. Ngoba kushuthi kungikhombisa ukuthi kushuthi thina asinalizwe eParliament ngoba nakho si-HIV positive.
It's just sad that there is this apathy and lethargy when it comes to this important report after it was launched.
Nami sengiyakwazi ukuthi nje ngixoxe nangakho ngisho ngakuthiwa nje ngiseklinikhi angisesabi sengiyaxoxa nje. Usuku lwanamhlanje lube isibusiso empilweni yami, lube nenjabulo enkulu. Kube ngathi khona umthwalo engiwethulile.
There is no policy in the department that would allow any woman to be forcefully sterilized for any reason. Allegations or the complaints referred to many years ago, for which lots of records are not available, and lots of individuals who could have been in the service at that time might no longer be around, either retired, passed away, or maybe could even not remember much about what would have happened.